Good day, everyone. On behalf of Global CIO Forum and Juniper Networks, I welcome you all to this virtual summit on artificial intelligence-driven healthcare, a foundation for patient-centered care. Before we kickstart this summit, let me just give you a very brief introduction about today's event. As healthcare providers accelerate value-based care and business transformation, the foundational IT infrastructure needs to be resilient, adaptable, and efficient. Juniper's AI-driven healthcare network architecture enables the delivery of reliable, secure, and flexible networking for hospitals, labs, and other medical offices at administrative locations, as well as data centers in cloud instances. During this summit, we will uncover some of the benefits of AI-driven healthcare that deliver optimized and personalized network experiences everywhere. We will also focus on healthcare market situation and challenges and how Juniper can help. We will also discuss some use cases. Leading us through today's virtual summit is Rafat Al-Karmi, Senior Consulting Engineer, Juniper Networks. And before I hand it over to Rafat, just a few housekeeping rules for our attendees. All of you will be on mute throughout the session, so please do post your questions through the chat option, and we will be happy to take all of those at the end of this summit. Without any further delay, I request Rafat to take it forward from here.
Thank you a lot for the introduction and welcome everyone. My name is Rafat Karmi, as has been discussed and introduced. I will enable my camera right now, and I hope you can see it all. Yes, perfect. And today we will take you to a journey about AI-driven healthcare and what we mean with it, focusing and having the idea about the patient first and focus on the outcome. Before we go into details, let's have a quick introduction. Artificial intelligence redefine customer health experience in the region and in the healthcare especially. And most of the, the industrial customer think focusing on the connectivity in the healthcare because it become essential and because it's become a health matter for people that using the network. So all the healthcare and clinics today, they are focusing on highly connected digital driven network for mainstream administrative process to provide enhanced patient experience. For example, and this is just a quick, touch point or light. Modern network setup hospital and clinics with the opportunity of using AI smart wireless and smart wired network and with the SD-WAN connectivity to connect back to a centralized data center can leverage all this technology and deliver a service personalized to each patient from the wayfinding to understand what the next task each patient need to do and help them cross the whole journey. And this is very important to save the time and the effort for the hospital staff and for the patient himself. Now, there is several steps that many healthcare providers are taking in the technology that they are investing into hospital IT modernization efforts. One key technology is, as we mentioned, the wireless, the wire, the SD-WAN, and we don't need to forget about the security. So what AI bring as now IoT devices come to hospital and healthcare, and this is connecting patient vital information. And this any issue with it could be not matter of network down or up, could be a health threatening situation. So AI here come and play the roles, anticipating the user experience, the device experience, which cannot complain, the robotic system cannot complain, that all monitor in a proactive manner. In the same time, help the IT help desk support to look for any anomaly and predict if there's any problem before it happens. So this could save life, which cannot be putting in any ROI or CTO calculation at all. One life does matter. Now, in the agenda today, we are talking about the healthcare market situation today, where what the challenging, what we are doing, what the aim of the healthcare. Then we'll talk about how Juniper can fit and how it can help you to take it to the next level. Then we'll talk about our offering in very high level. We are not talking about product here. We talk about the outcome and value. Now, last but not least, we'll take use cases, example. We'll take one hospital example, how they could benefit from the AI-driven enterprise and what the possibility you also could have and build around it and top of it. So here, in the pandemic starting 2000, actually 19 late, and we had the whole 2020, under the same situation. But did we ever stop? The life continue and we moving forward. So what happened in the pandemic? Okay, we have NASA putting the first, robotic system on Mars. We have SpaceX and the project along with UE investment with Hyperloop reaching 760 mile per hour. And a lot of technology has moving ahead. Technology has become life dependency. Innovation, evolution is changing our habit and our culture. Patient and new diseases, as we could see in the last 2 years, are challenging and pressuring our healthcare institution and the way we are reacting or interacting with the patient. And the old way cannot continue. We cannot scale. And we saw a lot of changing in the last year, maybe more than the last 10 years alone, because we need to co-op with certain pandemic. But this is, we shouldn't stop over here. We need to continue. So technology provider like us, like Juniper, thrive to innovate. We push the boundaries and what possible and what's not possible. So actually we push it a lot. I will show you today. So what does the future bring to us? For example, and this is nothing to do in particular with the healthcare, but give you an idea where we are going. First, we are anticipating to have the first man on Mars soon. We anticipate to have the travel between London and Paris in less than an hour. And actually, there's a project between Dubai and Abu Dhabi in like a couple of minutes, and they are extending that project to link Saudi Arabia in our region. We become passenger to our self-driving cars in the near future, and we saw so many initiative around it. So we'll become another passenger, not a driver anymore. The delivery, we were happy about next day delivery. Now we are demanding same day delivery. With the robotic thing in US, Europe, they're starting 60-minute delivery. So we saw all this automation and AI around us. What about the network? Well, what about our core businesses that enable all these things? In the healthcare, if the network doesn't go up with the all investment you put in the software and the machine, the medical machine, then there's something missing. You cannot, deliver end-to-end services. Here, Juniper step in and we drive the first self-driving, self-healing network in the industry. And this has come with a challenge. And the pandemic, put even more pressure and accelerate this gap. We could see a lot of application move to the cloud, and in the healthcare, we saw a lot of diagnostic software, X-ray reading and translation moving to the cloud. And also we see the demand of bandwidth increase, treatments, like IoT devices. Now a lot of telemedicine coming to the play, a lot of devices connected with the patient at home, and you need to receive the data all the time. You need to be online, and any packet losses, it's an issue. The data has been moved from 5 exabyte, which is million terabyte, to 88.7 in the last 2 3 years. Okay, and also connected devices growing heavily to reach up to 12.3 billion devices in the coming year. And this, many of them, they are IoT devices. So this is nice. It's okay. We expand our IT, but the pressure coming with the cost. As the cost become a critical to all vertical, including the healthcare, to put the money where it should be, now becoming focusing on the IT headcounts. You need to do more with less. You need to expand and more system, but less people. And here AI become essential to help you to have that equation solved. Without it, it's almost impossible. Now, There's three, you know, uh, statement here. All the IT decision maker like yours here, you need to care about it. Modernization, how to do adopting our healthcare to meet the needs of the 21st century, and how to anticipate requirement before it become backlog and load on you. Second thing, the digitization. This is important now. Think about it. Before, in any hospital, I remember even previous history of our deployment in IT. IT only was deployed on the reception and certain back offices for the IT, and the HR, the accountant, never been in the doctor places, nurses, or patient. Now we are seeing IT become more essential and core. So all the data of the patient and the medical record become digital and need to be transformed from location to location securely. Now, transformation. Now, this is the end result and the goal, creating a working approach that the patient can provide the first level of information about his illness, sickness, or health situation before even he reached the hospital and healthcare using his IoT device, the connectivity with the hospital, the moment it reached, how you transact with the patient himself. This is very critical and to enhance the service with the minimal manual interaction. So, what the situation today? Let's look at it from what the healthcare looking for. First of all, the aim. What your aim as a healthcare? First of all, you'd like to have improve the health outcome. You need to make sure the patient receive the best health possible. This is the main core function of healthcare. And then you need to look about the patient individual experience. Did he feel that he have a personalized service? Did you anticipate his needs before he explain it, or he need to repeat himself multiple times, wasting his time? And we know, regardless how much the hospital or the clinic fancy as a building, as a service, the patient always on his nerve or her nerve because he's coming with illness and sickness, so he doesn't, he see everything magnified. Any mistake, we will see it multiplied by 10. Second, you like to have also secure access because data and privacy is a very, very critical element. Cost control, with all this what happening, cost control become essential. People they need to survive, even the commercial healthcare provider. The government one also budget will not be always available as before. So a lot of pressure on costing. Secure access and engagement. So, the EHR, the mobile health, the remote medical treatment, all this and telemedicine, this become with, you know, point about it, security, how to connect it, how to secure it, and how to provide even more personal services using the wayfinding, anticipating with using mobile app at the hospital, moving the patient from location to location, and integrate IoT devices. The infrastructure readiness. We know many healthcare and hospital, they are still way behind in infrastructure. So they need to focus on the collaboration technology like the video conferencing and sharing information. Data center, it's very critical. Regardless, you like to have it on-prem or hybrid between on-prem and cloud or completely public cloud, which is, I believe, we still a little bit early for it in our region. Security, you need to focus on security, not in the legacy way, not only firewall and you put and secure certain employee. Here, security become connected security, trust security. How to automate the security at the moment of attack. Also about transport of the data, how to send this data to individual patient, doctor, nurses, and staff. Of course, people they are moving from wired to wireless, from station to mobility. So we need to focus on that element as well. So the challenging as we could see today, and this is not only Juniper seeing it, but this is study has been published in early 2020, and it is shocking information around it about what's going on and how AI can really help, and it's become more critical. The first element, burden of preventive medical error. In the study that we have it, done by Australian group, estimated for every 100 patients, there's 14% misadvised or actually mistakenly treated. That cause around 50 million, avoidable injury per year worldwide. And this is the result. More than 25 million years of healthy life has been lost. In Australia alone, this injury cost healthcare by extra money around $262 million just as a penalty for misconduct or mistreatment for the healthcare itself. This is should be avoidable because it costs a lot and it affects people's life and health. The second one, medical information explosion. This has become fact. Every 73 days, the information about the human body get doubled. For the GB to get with this data, the study mentioned that he or the doctor need to read around 21 hours a day. So, which is virtually and practically it's impossible. So this means that a normal legacy way, the GB cannot be depending on legacy education, lecture, conferencing, not at all. And he need to find or she need to find different way of getting the information faster and treating his or her patient in a better way. The third one, you know, the slow diffusion of medical knowledge. Everybody remember in the pandemic last year, everybody was against the vaccine from the doctor and the healthcare in the whole world. The reason why? Because the vaccine took 6 months of R&D, 6 months of testing, then introducing to the public. Usually, 14% of all medicine R&D take its path to public only, and the average to get this approved, believe it or not, it's 17 years for medicine to be approved until it reached to the end user, the patient. So any patient get doctor treatment, it get a 2 decade old proven medication, and this gap need to be reduced. So one of the example how it's been reduced, that UAE invest in AI and was used actually speeding the the coronavirus treatment and the vaccine in Abu Dhabi when they treat all the analysis 3,000 people around the UAE took that program, and within 6 months they have the first virus vaccine produced to the public based on AI and treatment. This is essential. Also, efficiency. Now, maybe still in the Middle East and Africa, it's not hitting this year, maybe coming next year, that insurance companies changing the way in US and Europe how treating healthcare. Usually we are assuming that pay for a service. This is getting changed in the US and in Europe. This is now payment or fees for performance. So it depends about the hospital and the clinic performance. They get paid by the insurers and it will be like a tier. If you're having a lot of errors, then they will not pay you your fees like 20% deduction, 30, because they know might happen in the future. You get some penalty or sued, or you need to repeat the same treatment again and again. So this becoming important for healthcare to implement a modern AI end to end. Now, what this all to do with networking and infrastructure? Whatever AI you bring in the back end from medical software treatment, linking to the public cloud for AI compute, and to get the best data possible. Without a solid infrastructure, AI enabled, all what you did cannot be delivered on time in the right way, securely, and available, reliable all the time. So for that, data security and privacy become essential. So threats are changing with even COVID-19, because a lot of people work from home and a lot of patients need to communicate with their doctors from distance. Hacker find many different ways to be in the middle and even try to hack the medical records, because this become valuable actually more than any time. And with the IoT devices connected to the cloud or to the individual also become different source of attack. So this Juniper here release end-to-end security, but not static wise. It is automated with auto flow control. So we increase the visibility of your network because you cannot protect what you don't see. So that's important. So we increase the visibility using the AI and data correlation. Then we enable end-to-end security from the patient device until the most secure location, which is the data record and the AI correlation in your data center or in your hybrid cloud system. That all secure 24 by 7 for you in an automated way. So now the challenge, how you can build on top of all this and enable your current infrastructure to go to the next level. Scaling legacy network adds cost. Usually, a lot of vendors ask you to rip it all and change it. That shouldn't be the way. We need to sit and talk about what you have today, how you can add, on phases. You don't change the network overnight. You need to add level by level, but add in a modern way. So you need to start from like your data center, moving ahead with the access and the wireless system, and then secure it all. Increasing and focusing on the cyber attack is critical. Many hospitals and healthcare in the region, unfortunately, they missed these elements. So they built a fancy hospital, clinic, and they forget about, the Wi-Fi. Keep it open, and any people can attack or intercept between the nurse system, okay, and the patient. So I can see the records, including credit card or health information. Managing more devices. You need to plan from today what IoT devices the healthcare system require. Today, we have the nurse system, which is reading the blood pressure, the heartbeats, and all this kind of information. But in the future, maybe it's getting more details about it. Like Apple Watch or Samsung Watch or any wearable devices will provide more data from the patient before arriving to the hospital. So this IoT device come. You need to measure maybe the pollution at the entrance of the hospital, the temperature, the humidity, the people count in every single location. You like to trace people as well in the hospital about who was close to whom. All these IoT devices and system that's critical to be managed in a proper way. More important, bandwidth getting increased every single time. We started with the text chat only. We ended up with the video, and next will be hologram, which is more data. So you can have the 3D in front of you. You need to plan for more bandwidth all the time. Now, do you like to invest and implement all these technology on-prem? It will be commercially prohibited, and sometimes technology-wise it's impossible. Like if you like to have certain AI about the human body and certain, let's give an example, cancer treatment. To implement it for every hospital will cost way high, multi-million dollars. If you outbound this one to a cloud, shifting the workload to a cloud, analyze it, get it back with the result. It will save you time, make you faster in deploying the treatment and with much less cost. So this is benefit the healthcare institute and the patient, the individual one. The same thing coming by the way to the network. If you like to implement the full AI on-prem, will cost you tremendous amount of money, if even it's possible, because certain things technically cannot be done on a local level. So shift it to the cloud, make it immediate deployment and faster to go to the market with. So what we deliver as Juniper from technology perspective, high performance scalable cloud ready network. So we provide you with the infrastructure that on-prem and hyper to the cloud. So we give you the best of both. Automated self, forming fabric at data center with full automation. And from the cloud, you can manage, automate from A to Z in your data center with the minimal requirement to touch any single device with integration with the all virtualization. This immediately reflects reducing the capex for you, and more important, the OpEx, the operational cost. End-to-end visibility, so you know what's happening in your data center. Moving to the security vertical of it. So we provide you with the automated enforce in security that depend on the visibility we provide. Every single user, the moment they reach to your network, we know what they are doing, where they are doing it, at what time. Even if they leave your network and come back, we'll double check from the cloud side if there's any attack on these devices outside your network, and its suspicious behavior become, and we will inform you and we'll block and treat that as soon as possible. So we don't leave it to go across the whole network. Now, the AI-driven Wi-Fi and the switches. Now, this is the delivery point now, because you prepare your data center, you prepare your security. Now you need to interact with that individual, doctor, nurse, and patient, and even the staff. So you need to have the mobility across the healthcare, the hospital, the clinic, and you need to be faster, to troubleshoot any problem. Even you need to see the problem before it happens, because Wi-Fi becomes so critical for networking and for healthcare, especially because most of the IoT device, by the way, doesn't have cable, so it's connected over wireless. And most of the user, the patient, come with their mobile devices, and you could have your mobile app with all records. You can intercept the patient arrival and start the workflow immediately. Now, cost saving, of course, while you are using the new technology and reducing the requirement on prem devices, so you reduce the needed space. You can put something more critical for you, like a new X-ray machine or a new medical equipment that you need on prem. Also, the amount of people you need to run the system, it's reduced. And this is immediately has impact on your OPEX, 30 to 40% reduction from year one. More efficient in terms of power and space, standard based, and this is again critical. Network shouldn't be an isolated system. Infrastructure shouldn't be. It should be connected with your surrounding application and system. And this is cannot be done with a closed system. For that, Juniper uniquely positioned that we use only open standard protocol to interact with, and it has many use cases we can discuss with you individually, or you can see it even as a sample in the case study at the end of today's session. Now, Juniper outcome value, because without value, you don't need to change anything. With Juniper technology, you can increase the patient engagement, deliver better on-site experience. Think about it from the patient arriving to the hospital. You can welcome him, personalize the message, and you can take him to the doctor using the wayfinding. But not only this, as mall, and that's it. You need to inform the doctor, the nurse that patient arrived, reducing the gap. So we are now enhance the operation level. So there's no more waiting. I take him the best route to the doctor and tell him in which clinic. Even if there's anticipating at the parking level, we can do it. This increase the efficiency of the staff, and we don't need to waste slot time, which is worth maybe human life. Also, managing the assets and locating them faster. Imagine that all the time in hospital, people they are running, searching for the blood pressure machine, the wheelchair, other devices. You can see it live, in the dashboard, and the nurse can have it in no time. Automated enforcement. This is for security, for workflow, and this is also important for the healthcare. I will talk about certain example in the next slide. Now, this is immediately resulting lower OPEX. So we need less people to manage the network. We provide more with less, and more important, it's all AI driven. So you don't have the outage like other legacy network. It's work in the modern way and anticipating, behavior. So what we do provide as outcome in more details. In personalization, we provide healthcare, and this is critical for indoor navigation. The patient can know where's the doctor, so it doesn't need to wait and waste. We inform the nurse and the doctor the patient arrive, so we reduce the gap. Information push notification in the mobile health app. The patient can request assistance, or information, or the actual nurse also can do that with the doctor. So there's a collaboration over devices, location awarenesses. In the visibility, the asset tracking, patient location and safety mechanism, and this is a use case we will discuss it at the end of today's session about how we could use the location services to protect the safety of individual patients. Also, tracing and timing. Imagine that you can trace and time all the staff movement within the healthcare institution. Which location is most busy? Is the nurse on the right, ward or section at the right time? If there is any, you know, weird movement in section in a hospital, could be an emergency. So you need to be aware, and all that can be fed to a third-party system where correlated with other information to provide you with the good data. Analytics, one of the issue in the hospital how to clean it, because always it's open 24 by 7. With the analytical reporting, you know which area is busy, which not, so you can close and clean. Also, how to redefine the real estate. Where's the reception to be? Where's the first clinic? If I know most of my patients coming to the reception, then go right. For example, because of that, 2, 3 clinics, I can redistribute them because I like to distribute the load, so it make no, occupancy high at certain level and others not utilized. This is important. And connected security, I can enable notification on silent for the security team or for the nurses for emergency without the panic of the speaker. Operation simplicity, user experience metric. If a patient come, see a welcoming message for his mobile app. Hi, sir, or Mr. So and so, your doctor at the second floor. Let me take you with. He will feel a little bit more comfort. If I deliver for him what he need to prepare for, or when he finish your next appointment, and I will take you to the pharmacy or to the lab because you have certain follow-up automated. So like you hire 24 by 7 personalized nurse with every single patient. This is bring more trust and more relaxing point to the each patient, coming to that institute. So why Juniper? Why AI-driven enterprise? We built it completely from scratch, from client to cloud concept. So our AI is the foundation of it. AI cannot build on top of product. It cannot be as an add-on product at all. You cannot start legacy then start, okay, this is an AI product. So we started from scratch as a white sheet and we add the AI. So our message and focus is user experience from client device, IoT, until the cloud application, which could be on-prem or public cloud, up to you. This is what we measure. Differentiated architecture. We don't use legacy cloud technique. We use microservices, meaning, and this is very, very critical here, that every single sub-application run in a container microservice space. There's no dependency between service A and service B. Whatever happened, okay, there's nothing called downtime or outage. Always the service up and running. If there is any crash in a single service, it will be replaced all the time. Security-wise and patches all happen at real time while you are running and working. The cloud get new feature, fixes on the fly. You don't need to have the legacy, okay, down, and we need to run service out, which is could be delaying patient, procedure. Land and expand. You don't need to worry about how you scale the service. You like to start today only with wired network to enhance your network, then you will build up Wi-Fi, then you need to have location, then security, the phases. Do you need to worry about all this from day number one? Absolutely not. Because, with the cloud, you can increase the service by enabling things. Like you have, a large engine car and you drive slowly, then you increase the speed, you go to the second level, third level, fourth level without changing your car itself. Real result, and we'll talk about it in a quick example after a while. So just, to take you with the remembering things, you need to worry about what we are delivering. Assurance. We are the only one who deliver network assurance about user experience. And again, we shift the whole concept from managing devices to managing user experience. So we give a way the IT can assure the service for individual user device, including IoT and robotic system. Cloud first, the whole concept. We have all the technology cloud ready or shifted to the cloud and designed for it. So you don't need to worry about investing today and change everything after 2, 3 years when become all the load moving to the cloud. Self-driving. We don't need you to invest time in code and double check command line and device healthy. All self-driving, you need to see only the outcome. A simple dashboard tell you if your network is running in a good way, your users are happy, not happy, and that's it. You don't need to worry about network anymore. You don't need to run in deeply training to manage a simple network. Secure. We provided and covered end-to-end security from data privacy, including the cloud connectivity. So there's no user data go to the cloud, and we keep all the data and the records on the cloud itself. Sorry. Marvis, might some of you heard about it. Marvis is a trademark for Juniper, and Marvis is the AI face. So it's the AI interface that you interact with. Doesn't mean if you don't have Marvis, you don't have the AI in Juniper, but this make it more visible, more exposed to everyone. We changed the way network manage devices and the IT interact with network and system using dashboard to something else. If you recall how people change their life using Alexa from Amazon, Siri from Apple, Google Home to interact with devices by voice command or by talking or texting, a virtual assistant. So we took that to the next level. And if you remember that we said Juniper pushing the boundary to new level, and this one of it. We are the only and the first network provider that provide you with a network virtual assistants that change the whole spectrum of network management. You don't need to go to individual device, check the memory utilization, CPU, cable. That's part of history. That's wrong. Now you check with the system and ask them, how's my network today? And this is the only way you need to interact with the system better than anything else, simple. And you can troubleshoot a device like the IoT in room 234 is not working good. So Marvis, troubleshoot that device. Tell me why it's not good. Or tell me about unhappy user experience today. So even Juniper itself, today we are using Marvis to solve user issues that come back to us as a ticketing system. So we reach actually 77% that Marvis solve it by its own. And every day Marvis learning and getting smarter. And Marvis today is 7 years old boy. So this is cannot be built on one day. This is always, cumulative information and knowledge. So if somebody come today with an AI still not released to public, it cannot perform like what we did. This is take millions of user data interaction and million of access point switches, routers, security, and come up and learn and come with you for a solution. For that, Gartner put us as leader in the wired and wireless network for a reason, for the AI and way we solve user problem. And this doesn't finish at the wired and wireless side. Well, we did start there, but we extended all the way to the connectivity, like the SD-WAN, to enhance the performance of limited bandwidth and make more visibility about specific application. This enabled telemetry to go all the way from home to the hospital. So all the telemedicine and the remote healthcare be possible, connecting to the nurse and doctor at home, providing the same experience as the hospital, also possible and at very affordable cost. We took it further step with the data center automation to make it simple as an access network. So why should data center be complicated? Abstract is the way of automation and make it simple. If you didn't try it, give it a try, and we have live demo for all these applications. So you can contact the Juniper directly for any of these. Now, we'll take it for a real use case. Before we go there, did we have customer using it? Of course. So it's not a green field that you need to try as a beta test. All this has been proven, tested, and experienced. All these large hospitals around the world and big name, they tested and their user experience get enhanced. And we are happy to share the experience with every one of you. If you need this, contact us and we'll do that. And let's take it as a use cases now. What you can deliver. We talk about welcoming patient from day number one. So this is personalized service. Updating patient and doctor information. So imagine the patient didn't arrive 5 minutes before his time with the doctor. That means the doctor can take the next patient available, so reducing the gap. Or I can actually send the patient directly to the doctor, reducing the questioning and searching about location. Next, car parking integration that give you more smart use cases to reroute the traffic. Patient next step update. After the patient finish, can I take him to the lab? I can take him to the pharmacy. I can move him. Patient request, he can use it using smart devices and request the service without telling him in which room or which nurse. So the nearest nurse will come across because location is there. Now, for the operation side, finding an asset at the quick time is important for hospital. Updating doctor about patient information real time anywhere, at home or at hospital. If he moves there and here and there, he can know about the patient, even especially in the recovery phase. Sometimes the patient need to move within the hospital, so he can track that as well. Staff efficiency. If we mentioned if the doctor and nurses and the staff moving in the proper way at the right location, right time, you can monitor it and you can see it as well. Analytics, you can find analytics about the utilization of not only network, that's simple, about the real use of your hospital or healthcare institute, like which room get more busy, which lab get more busy, sorry, which toilet and restroom get more busy, and pharmacy when it's the peak time, shall I have another one or not, about the rest area, the men and women, all this kind of thing, it is possible. I will show you now a quick video about what happened in one of our hospital, which we'll talk about it after this. There is two scenarios here. To the left, a patient requests an assistance. To the right of your screen, a patient requests a wheelchair from a nurse. And see how the mobile app interact with only two to the left and three-way in the right. So two users and one asset. And this is it gives you more flexibility and personalized service for individual patient. And this is not like a dream or something from the future. This is already deployed in a hospital in US, and this is the hospital. It's called VA Medical Center at Lake Nona, and this is a huge one, 65-acre campus serving more than 400,000 veterans every year. So what their challenges start? A part of the medical challenge, okay? They are having large campuses, so they need to direct patient to the right building because it's a huge one, and right rooms, right doctors all the time. And also they need to post the patient experience across the campus. So they deploy Juniper end-to-end technology. What they deployed first, they apply the indoor navigation, and so check in from the main gate, arrive until he reach require walking couple of minutes, and this is becoming experience now for him because we take him through the journey. So now they implement more than 5,000 access point and the mobile app integrating with it. So what the result? Better patient experience. They monitor more utilization about where the patient goes, and they use a third case, which is they were never thought about before, which is how to protect these patients from getting lost within the campus, because some of them they have a memory issue and concentration issue, so they are not allowed to leave building. So what they did, They have all the patients with BLE tags, so they wear the BLE bracelet. And this is now practicing and going around the hospital. And at the moment they reach to near to the exit door, the main door, it become alert. So there's a workflow alerting the security. At the same time, door get locked, so it doesn't allow this door to be open without security clear it again. So this is the utilize some of the IoT fundamental power with Juniper technique. Why? Because you are using standard API and integration become easy for the system. So now, last but not least, as a requirement and use cases. And the pandemic actually brought this idea, which is the tracing. In a hospital, some diseases, maybe you discovered it 2 3 days ago, that some patients have contagious disease, and immediately the case close that section completely, close the building, because we don't know who was there, and then you need to go to check the records. But if you have all your patient employee with the mobile app and with the bracelet BLE, you can trace who was near that infected person in that location, and you can request them for self-isolation treatment directly. With COVID-19, before COVID and even after COVID, you never know what diseases come. So always this should be an ability in healthcare to be there. So proximity tracing, congestion notification, you don't need any area to be overcrowded. Not because of the social distancing limitation today, but in hospital usually it's not good to have any area congestion, because you never know what disease around and what risk that individual brings to the community around him, from emergency room until the exit point. So this is a journey we need to monitor all the utilization. With this, you know, I conclude today the AI-driven healthcare, focusing on the patient. And we did not talk about boxes and product in specific. We talk about vision and journey. Thank you for your time, and I hope we add more value and more information to you. Thank you. Back to you, Manila.
Thanks, Rifat, for that. It was pretty interesting, especially the part where you mentioned about the challenges. The numbers were quite startling, but it's great to see what Juniper can do with its solution. And yes, talking more about the vision and journey was more interesting than just talking about the solution. I would add that. And our audience wants to hear more from you, so I have some questions coming in. The first one is, as AI becomes fundamental for all verticals, can a hospital or a healthcare provider start gradually or must have it in one go?
That's an excellent question, actually, and I believe we touch bases on it in one of our slides. That the power of cloud, AI on the cloud, it gives you the flexibility to build it in gradual level. So you can start with every single, horizontal technology alone. So you can stack it and update one by one. Give an example: a hospital like to employ some smart wireless to start immediately deploying certain feature, or a network, and still his data center investment not complete. He can start today, or he can start with the security around it, and all this workload shifted to the cloud, so he doesn't have dependency that much. So he can start gradually and with the streamline the investment about every single technology alone.
Okay. And you spoke about Marvis Virtual Network Assistant, which is, I think, 7 years old now. Can you throw some more light and tell us more about that, and maybe some more use cases if you have any?
Yeah, sure. Marvis is a trademark for us, and I believe most of us really attend, the Iron Man movie, and Garvis, which is the AI assistant for the hero in that nice suit. So our, founder thought about it, and he said, okay, let have the same technology helping the network. And with this, we built up Marvis 7 years ago and start learning. And some of the use cases of it is how to anticipate problem before it happens. And give you an example, we had it in a customer without mentioning the name. They have around 240,000 access point and 1,000 switches. And They are huge, massive network, actually the largest enterprise ever. And they deploy our technology. And when we deploy Marvis, and Marvis starts say, oh, Mr. IT admin, I discovered there is missing VLAN in that network and a couple of bad cables in here. So they couldn't believe. They said, no way, no complaint, no problem. So this is something wrong with the system. So I said, give it a try, double check. When they went down and troubleshoot these individual, as Marvis indicate, they were shocked that how the user actually get adapt to problem, the individual user, like a wireless roaming for telephony that has a problem and disconnectivity, it become normal for the user. But with Marvis, discover it, and when they ask, yeah, we get used to it. And now when get resolved, everybody was astonishing that how the system really double check thousands of Ethernet ports, thousands of access points in matter of minutes, and conclude you have this problem and this problem, go and fix this and that with no delay. Other thing about Marvis will monitor the user experience. Like today we are having, the conference call here and remote session, and we can double check individually if we are at the network of Juniper that how was this call experience. So we can double check, is it a PC problem? Is it a wireless problem? Is it a WAN network problem? Is it a server problem, application level? I will tell you where it happened and when it happened. So you can have it next time in a better way. Or we can prioritize it next time if you need it more critical than other. So this is just some example of Marvis in the networking industry. If any hospital or healthcare interested in this, we can demonstrate multiple use cases and application. We can see it live in your network in no time.
Okay, that was quite an interesting story. I have one more question coming in, which is as more application and services, including network services, become cloud centric, how is the security taken care of? I know you touched upon this point, but just if you could elaborate a bit more.
Oh yeah, sure. Now with workload shifting to the cloud, it's open actually a very legitimate and right question about security. What will happen if the cloud, get breached or attacked, or is my data or my patient data, especially in the healthcare, is on the cloud? In Juniper, what we do, we provide the AI compute power and the centric and the collaboration and the correlation on the cloud and the configuration capability. The user data, the patient record, the patient information, it all still on your prem. So we don't, as Juniper, we don't have your user data coming to us, not even the traffic. So this is very, very critical and elements in our privacy and data protection way. So we don't have user data. Secondly, for other application using the cloud, taking that data, patient data or records to the cloud to measure actually like a healthcare application. Now what we do, we encrypt all the traffic from user to hospital, from hospital to the cloud and the way back. And we have our Juniper ATP, which is the advanced threat prevention, which take a measure about not only known issue in security within your premise, but we take it globally. That we study the whole, worldwide network elements, the update. We have a lot of third-party feeds about the where's the threats, where's the black points in the network, where's the hackers, where's the attacker, what the anomaly. All this we bring it to you at your prime and tell you that user is a risk, this user risk. And now, because we have a lot of visibility about the network, and we use all the cloud intelligence, not only to scan your network, but scan the whole worldwide and get you the benefit out of it. If we see something wrong happen, we are not waiting you to act after 1 day, two. Many of the critical application of in Juniper start acting, isolating the infected one, and put him on a side, treat him the way it should be treated. Okay, depend about the alert and the security measure that you set up at the beginning without affecting the others. So moving to the cloud actually bring more security because everything gets measured, monitored in a proper way. In the old way, in the isolated, you have like elements forgetting about it. How many times a CCTV camera not connected and somebody connect device to it and hack the network? How many times IoT device not batch and is not connected in proper way and become a source of attack? And we saw a lot of stories about it. The last thing in the pipeline in US.
Okay. Okay, that's quite insightful, I would say, Rafat. But before we just sign off, I just want to know, if I give you, say, 60 seconds, what would be your key main takeaway from this whole presentation?
Okay, for me, healthcare is a special topic for me personally because I started working on it about 20 years ago. So I wish that every single CIO and IT, decision maker in healthcare take this more uh, priority about how to deploy AI today, how to take the healthcare to the next level where every single patient really deserve, and how we can provide better healthcare for everyone at affordable price. Affordable price mean better infrastructure, better collaboration, and better way of delivering. So this is where we really differentiate ourselves about the business and the user experience outcome. The devices become commodity as switch, AB, a router. It's about how the intelligence around it, how the AI around it, how we can help actually, the hospital, the healthcare to excel and exceed the anticipation in this critical time.
Okay, I think better collaboration and delivery, definitely, especially in these given times of the pandemic, is very, very important. Thank you so much, Rafat, for joining us today. And on behalf of Global
Thank you.
CIO Forum and Juniper Networks, I thank all the attendees for being with us. We look forward to see you again. Goodbye and have a nice day.
Thank you. Thanks, everyone.